Hello, everyone, and welcome to Your Health in Your Hands. I'm Dr. David Ajibade, founder and director of the Brain and Body Foundation. And our goal with Your Health in Your Hands is to provide you with the best information possible for you as a Nigerian to take control of your health and that of your families. Now, as you know, at the foundation, our main goal when it comes to care and support is among those with children with brain disorders and sickle cell disease. In a previous show, we had the Danjuma family. They talked about their experience with their son. I believe it was Dairos. Dairos is his name, who had severe brain damage after delivery, and they talked about the improvements they've seen over the years of having worked with the Brain and Body Foundation. But it's not enough just to have a condition and then treat it or care for it. It's more important to prevent that condition. And I think in Nigeria we have a big problem, especially around the time of birth. I think the statistics, if they haven't changed much, I doubt if they have, the statistics say that over 70% of all childbirths do not occur in a hospital or under expert care. And that's terrible. It leaves you wide open for all kinds of complications and permanent damage and disability, especially in children. And it's just not fair to start children with severe disabilities if they could have been prevented. I'm going to give you a few quick examples of some of the people that we've seen that this kind of thing happened. One of them is a good friend of mine. They did everything right. He and his wife did. They attended antenatal clinic. They took all the medications. Everything went right in a very good hospital in the north here. And then when it came to the time of childbirth, the doctors went on strike around the same time, and so of course they took the wife to the hospital. Ended up being a complicated labor. Ended up having a child with severe brain damage because the nurses who are on ground were not able to deal with that complication. Now they're dealing with a child for the rest of their lives who will be disabled. This could easily have been prevented. Another example is another couple. They had twins. And at the time of delivery, they went to a very well-known private hospital here in Abuja. And delivery went okay, but a few days after delivery, both children developed jaundice. Now, you can't really predict which child will develop jaundice, but usually you should be able to have the equipment on ground to take care of that. And that's part of what we'll be talking about in this show, in this episode. But back to our story. Both kids developed jaundice, and one of them, and these are identical twins, one of them escaped. The other one developed severe brain damage. I'm talking about severe brain damage, and because these are identical twins, you could actually see the difference in development. Why did one develop? Why did one escape and the other one did not? I don't know why. But the bottom line is that hospital, even though they said they had phototherapy available to address the jaundice, they found out later on that the phototherapy machines, the phototherapy units, weren't actually working. Think about that. The unit that was supposed to save this child's life and treat this child were not working, and you end up with a child with severe brain damage. Anyway, you could see the delays in milestones. By the time she came to our foundation, she couldn't walk, she couldn't talk. They were severe. She had a squint. Her dentition was several months behind. Anyway, we were able to help. We had some great results from that. But we're not talking about the foundation now. We want to talk about what hospitals, doctors, and you, the average person, need to know about delivery and ensuring that you have a strong, healthy child that will not have disabilities growing further. So I'll take a short break from now, and we will be right back. Okay, welcome back. I have on this program with me today Dr. Edward Okundaye, who is the MD, CEO of Supreme Meditech, which is, tell me about what that company is.
Okay, Supreme Meditech is a company that's specialized in medical equipping. Mm-hmm. Okay, and we have a mantra that we're into giving healthcare professionalism a new look by properly equipping the otherwise good doctor, that would have excelled in his field if he were abroad, okay, or in the Western world, but he lacks the tools or the right equipment to do justice to his profession. So we're that bridge. We saw that vacuum, or we saw the lacuna, and we're filling that vacuum, and equipping doctors for better healthcare professionalism.
God knows we need that. So thank you so much for taking the time to be on the show today. We really appreciate it.
It's a pleasure.
And of course, we've been friends for a while, so we're not entirely strangers. We do know a lot about Supreme Meditech. But you're a medical doctor as well, which gives you an added advantage.
Yes.
Especially in the field of maternal and child health. I know when we first met you, you actually worked in a hospital that focused on that, right?
Yeah.
So these stories that I told earlier on, they kind of...
they resonate because we see it all the time. Okay, you see, in life, the start, is very important, and birth is a start. Okay, so if there's a problem at birth or a problem with the start, it gives the child, puts the child at a disadvantage.
Right.
As you said, the issue of the twin was particularly worrisome or troubling, where one of the twin was doing well and the other wasn't doing well because of a defective phototherapy machine.
Right.
Okay, that's where we're coming. Okay, even there's a little more advancement in that aspect. Previously you put the baby on the conventional phototherapy unit that gives heat up the baby. We now talk about things like dehydration allowance and all that, but there are beautiful machines now that just gives the blue ray of light, taking care of the jaundice without heating up the baby, and survival rate or time spent in the hospital is shortened, and that baby lives healthier afterwards. Okay, but talking about other things that could affect the baby's brain development, one is oxygen.
Right.
Yeah, the brain needs to be perfused.
Right.
The baby is coming out from an environment filled with water. Takes it, his or her first breaths. What could be obstructing the airway or for proper perfusion of the brain? So you want to use a suction device. Clear the system, clear the airway. Okay, afterwards you want oxygen to get into the brain.
Right.
Okay,
crucial.
Now, yes, so you hear us talking about APGAR score. APGAR score is a form of timing in the first minute. Okay, first 5 minutes. Okay, these are parameters that help to say, oh, this child will be very intelligent in the first minute. It cries, it takes a deep breath and all that. Okay, so is oxygen getting to the brain? Yes, no, why? You do some interventions. Yes, is it adequate? Okay, so if the baby is pink in room air, beautiful. If the baby is grayish, do you want to give supplementary oxygen? You won't believe that in some good hospitals oxygen is lacking.
I was mentioning about this on one of our other previous episodes, and it's like that is the commonest drug being used in the Western world.
Yes.
Oxygen is it's taken for granted.
Yes.
Every hospital has to have oxygen.
Yes.
You're telling me that this is so we can even forget the primary healthcare centers and even the secondary healthcare centers.
You wouldn't even imagine.
Okay.
In hospitals where you think should be standard,
yes,
you still hear in this day and age people talk about oxygen not being in the system. No oxygen, empty cylinder.
That's another one.
Poor delivery
yes.
of supply of oxygen. It's amazing.
So how do you try it? I know you try your best, and you've already said it. You're trying to improve the standard of care so that it's comparable with the Western world. That's a tall order, I have to say. I would say almost impossible. Well, let's not say impossible, but it's a difficult thing. How do you overcome that?
Yes, I have this mindset that impossibility doesn't exist. If it's possible, and I can say, or I can boast and say, it's easy for me because the Western world have gone far ahead of us. So what we're trying to do is to catch up. Okay, what are they doing right? How do we, replicate it over here? Okay, for instance, in the case of oxygen,
yes,
there are oxygen generators that you could put in your system, and you have oxygen 24/7. You could even make some business out of it. So oxygen not being in the system should be a thing of the past. There are small devices, depending on your budget, depending on how many patients you have, from small oxygen generators up to having 1,000 beds, if you want to say that.
You can have an oxygen generator for...
Yes, and generator, prepare your own oxygen, and make sure your patients always have oxygen in the system.
I mentioned that initial story about the child who was, had prolonged labor. The mother had prolonged labor, excuse me, and eventually the child came, which was hypoxic, was not breathing at all. I think they had to resuscitate. In that case, could oxygen have helped if, as soon as she came out, they flooded her system with oxygen? What could have been different in that case? What do you think?
Yes, oxygen could have helped, but even before delivery, the mother should have been monitored with a device called a cardiotachograph, a CTG, machine, as most doctors know it, to pick up fetal distress in labor. So when you pick it up, do you want intervention? Do you want to do a CS? Okay. If you don't want to do a CS, you want to observe more. You want to give the mother oxygen and watch. So all these are things that will help, to make sure your baby comes out healthy. Okay. So if you place the mother on oxygen, the CTG machine, improves. Says the fetal distress is reducing. Fantastic. It's not improving. Intervention. Okay, so these are clear-cut indices where medical gadgets, medical equipment comes into play and helps. It just makes the doctor's life easy.
Yes, and the patient's life easier, easier as well. So again, folks, it's so important that you don't. We talk about taking your health in your hands, and that's the name of the show. But in some cases, you don't take it into your own hands, especially around this very sensitive period of childbirth and labor. You've got to get the right kind of attention. You've got to get expertise, go to the right establishments, so that if in the event of anything going wrong, there's the equipment and the expertise to take care of the mother and the child, so that we don't have this huge numbers of kids coming out with severe disabilities. So please pay attention to that. We will be right back shortly. Okay, welcome back. So with this show, I'm really looking to let you guys know what are the standard things that should be available if you are going to have a delivery. If you're taking your wife, madam is going to the hospital, these are the things that should be in place. Now, I'm sure, I know not everything can be done, but at least have this in mind, so that if you can check these things before you go to the hospital. I think the hospital say they don't have, you can arrange to have for the sake of your child's delivery. You understand what I'm saying? Does that kind of make sense, Doc?
Yes, it does.
Okay.
Yeah.
So let's talk about the things that you feel should be available at the time of delivery.
Okay, at the time of delivery, let's picture the baby transiting from the
womb,
the womb environment to the exterior, a warm environment. Okay, so preparing to take the delivery, you want to ensure that there's a resuscitator or a radiant warmer, to warm up the baby, and prevent the baby from being cold. You remember the baby was in a warm environment. Okay, I said you want to ensure that the airway is clear, a suction device. Okay, you want to ensure that there's an ample bag, to help the baby, in breathing properly. Okay, you want to ensure that there's an autoclave in the hospital. Autoclave is a device to sterilize, equipments, to be used for cutting, okay, for clamping, where there are no disposables, which should be the standard, should be disposables. Okay, you want to make sure that there's an autoclave in the in the system,
because a lot of infection can happen just from that cutting of the cord that can cause major problems.
Yes, and infections can lead to sepsis and affect the brain. And yes, so you want to prevent that. From the beginning, tetanus, and all that. Okay, you want to ensure, that there's a doctor to take the delivery, or a well-trained nurse, to take the delivery, to attend to the baby and make sure that to monitor the baby and make sure everything moves smoothly or as anticipated. You want to ensure, in case there's any challenge, that the hospital has an incubator, to keep the baby warm. You want to ensure that in case there's anything like respiratory distress syndrome, or where the baby is not breathing well, that the hospital has devices like a bubble CPAP ventilator. If the baby comes out prematurely, you want to ensure that the hospital has things like medical drugs like surfactant, which was rare before, but from Supreme Meditech we kept pushing for neonatal improvement. And we're happy to say that books have been churned out, and Nigeria is presently a champion in the West Africa region, from bubble CPAP intervention and all that.
So surfactant is more widely available now.
Yes, it's readily more available than it used to be. In a few years, where you give birth to a baby and they tell you baby survival rate is 50-50. You don't hear that anymore. It has improved drastically. You give the baby surfactant. You use what you call the insure technique. You intubate the surfactant, you extubate, you put the baby on CPAP. Bubble CPAP is a form of ventilator to make sure the lungs are well perfused and survival rate improves. And when we say survival rate, the baby living healthily with a well developed brain, with attaining the milestones at the right time, and all that. So if all these are in play with the right person to use them, the baby has a beautiful head start, to compete, with his peers in these challenging times.
So crucial.
Yes.
So crucial. And as we've said over and over again, some of these things might actually be small things that Dr. Okundaye is talking about, but they make such a huge progress, such a huge difference. Again, with the foundation, we see kids of different ages, and you can see most of the problems started at this time that we're talking about, at that time of birth. The right things were not attended to. People took things for granted. The experts, something just went wrong. So it's so important. Okay, what else should be in a neonatal unit, for instance? By the way, great work what you're trying to do to change things and make things, these equipment and reagents available. But I don't think, do we have good survival rates for premature births? I know that's a tough one too.
Yes, in the past 7 years, the survival rate has improved drastically.
Really?
Yes, referring to what I was saying initially, of you walk into a hospital before 7 years, before Supreme Meditech started pushing gadgets like bubble CPAP and all that, and you hear stories of the survival rate is 50-50. We've left that stage. So you walk into a hospital, a standard hospital, with bubble CPAP, with surfactant in their pharmacy. You take the baby comes out, you apply these gadgets and put in your surfactant. The survival rate greatly improves. Yes, it greatly improves. So we are catching up with the Western world. And yes, I can say that we will get there very soon. I'm optimistic.
That's fantastic.
Yes.
That's fantastic. So do you work with government hospitals or is it private hospitals more? I'm sure one is easier than the other, but what's your experience trying to convince, especially private hospitals now, because everybody's there looking at their costs and they have to make sure that they don't spend more than they have budgeted for. Yeah, so.
I would say that the Nigerian doctor really wants to see a change. Surprisingly, the Nigerian doctor really wants to see a change. Private, government, you see, in the government setting, the doctors are pushing, trying to work the system to get these equipments into the system.
Really?
The private is easier in the private setting, but you see, they even tend to push me right now. They tend to push us more than we would have anticipated. Okay, so the doctors, they really want to see a change.
So they are making demands. They are asking you to search and supply certain equipment. Oh, that's great.
Yes,
that's great.
Yes, so that's why we've improved so fast. There's a long way to go.
Yeah, of course.
To say we've gotten there, but we are on the right track.
All right, Doc, so thank you so much.
It's a pleasure.
This has been very educative. And listen, we wish you all the very best in getting this out there, especially with the government. I'm sure you're also working on putting policies in place so that more and more hospitals, especially the private healthcare centers, will at least enjoy some of these amenities that are available in the bigger hospitals.
Thank you very much.
Thank you so much. Appreciate it.
Anytime.
So does that mean we'll get you back on sometime?
Yeah, anytime.
Awesome. They heard it. Over 1 million people heard you say that. So so you can't escape.
No problem.
All right, folks. There you have it, folks. So important. Let's give our children the best start in life, and some of the things that it takes to do that. In other talks, we'll be talking about how to raise a healthy kid, and of course, you can't raise a healthy kid without the emotional supports and spiritual support, psychosocial supports. This all comes together. But at this point, we have to end, and so we're going to say thank you. God bless. Keep watching our shows and stay tuned.